Hello, my name is Tammy Gravel. I am the Dean and Chief Nurse Administrator for the School of Nursing at MCPHS. The School of Nursing traverses 3 physical campuses, Boston, Worcester, and Manchester, New Hampshire, and we have an online graduate program, and I oversee all of those programs. If you're joining us as a traditional student, you will start in the School of Arts and Sciences, and the School of Arts and Sciences is really a place where you'll learn the foundational information that will carry you forward to the School of Nursing and the professional BSN curriculum. I think it's an exciting time to start bringing together the things that you've learned, and you will begin to practice as soon as you join us by using places like this, the Skills Lab, as well as clinical rotations. What you learn in class will be applied in these areas. I think students who leave here are ready for transition into practice, and that's our goal. You become a student here and you're ready by the time you leave to transition to whatever practice environment that you would like to begin your journey on as an entry-level practitioner. Students are prepared for the licensure exam from day one when they first walk in the door. They're taking practice tests and regular exams that set you up for success with the NCLEX. At the conclusion of the program, we offer a required 3-day NCLEX review. And again, the whole goal is to get you ready for transition into practice and successful licensure. Our pass rates for NCLEX, and we measure that by first-time pass rates for quality. And our pass rates here in Boston are greater than 95%, and that's above the national benchmark. So it's exciting, and it really speaks to the preparedness of our graduates, as well as the work that the faculty do in getting them ready for transition into practice. The Boston campus in particular is a very large campus when we talk about numbers of students. We have a variety of resources here to support the student, from the faculty at the beginning, and in each course, students have faculty advisors in the School of Nursing. We also have a new role called the Student Success Navigator, and that Student Success Navigator helps bridge the relationship between our faculty, our student, and some of our other resources in the university, specifically the Center for Academic Success and Enrichment, or CASE. And the goal, again, is to provide the students with the resources they need to help them be successful in each course, each level, and each program. And I think that students will find that helpful, but it's a partnership in learning. If something is going on with a student or they need the help, they need to reach out to their faculty advisor or their core faculty in the classroom. A student who's first joining us in the BSN professional curriculum, we call it the 200 level. And students here will learn things like nursing skills, where they learn how to take vital signs, where they can learn how to do dressings on a patient, where they learn to also do a health assessment, so a head-to-toe assessment, listening to hearts and lungs and bowel sounds and all kinds of fun things. And those practice pieces are done in our labs. And that gives the student a safe place to practice those skills without worrying about, am I going to hurt a patient, or am I going to get all the right information? And each one of those sessions are led by our clinical or a core faculty member. Once a student has been in the program for a few weeks, they also transition to the clinical setting. The clinical setting is designed to meet the learning outcomes of that first 200 level, starting to put things together, how to take vital signs, what does that mean for that patient, how to listen to lungs, again, what does that mean for that patient, and what is the care that we should be looking for. And again, that's led and coordinated by a clinical faculty. So students it's more than just being in the classroom, it's really applying their learning the first semester. Students who are excited about the profession of nursing and would like to continue their education post BSN degree or first level licensure, we have an online graduate program. Those online graduate programs prepare advanced practice nurses in the area of family nurse practitioner or mental health nurse practitioner. And again, these are advanced practice roles that require certification after the end of the program. We also have a Doctor of Nursing practice program. So if you get really excited, you can go from the BSN level all the way to the doctorate level. And the doctorate level is for a practice or advanced practice nurse. Students are usually nervous before they come into our program. We have a full day orientation for students to meet the faculty, meet their classroom advisors, also learn about the technology that we use in the classroom, so then the first day won't be so overwhelming. It'll be a nice seamless transition. They'll work with the clinical placement folks, and the goal of that is to get them ready to go to clinical. The timeliness of that work has to happen quickly in order for a student to transition to practice. And again, as I mentioned earlier, we have peer tutors, we have peer mentors, our faculty supports, our student success navigator. All of those resources are here for the student. And again, it's a partnership. It's reaching out and saying, I need some support, extra support in this or that. Our core faculty are an amazing, committed group, and we have both core and adjunct faculty that work with us in the School of Nursing, and also some staff. I will share with you that the core faculty, as well as the adjunct, go above and beyond to support nursing students. We've had faculty that leave a Zoom link open all day for students to drop in and do office hours. We also have an NCLEX success coach, so if students are having difficulty with test-taking strategies or content areas, she's the person that they can reach out to, and she does all hours of the day and night just to help support student success. So there's a lot of resources in place to help students transition, hopefully allay some of the nervousness of transitioning into the School of Nursing. And again, that partnership of reaching out, just like we do in our clinical setting and being a team, it's a team here in the School of Nursing. Our students in our first year of our professional curriculum enter a clinical rotation that will help them apply the knowledge and skill they learned in both the classroom and the lab setting. It usually takes place in extended care facilities or rehab facilities, and again, because the pace is a little bit different, it allows students the time to apply that learning. The clinical is facilitated by a clinical faculty in collaboration with a core faculty member. And again, our goal is to help that student transition the skills that they're learning right into the clinical setting. And then subsequent clinicals build upon that first level clinical in the following 3 semesters.